Welcome everybody, we're here to talk about sublingual medication administration. What does that mean? That means into the mouth, into the tongue. You see those nice blue vessels there, arteries, the nice red ones? That's exactly what we want to use sublingual medication administration techniques to do it properly. That's what's coming up next. As always, please subscribe to my channel, like, or comment below, and I'll try to address your questions there for the class. It's a good way of taking care of your questions rather than email. Thank you everybody for paying attention. So the most commonly used sublingual medication when indicated for chest pain is nitroglycerin. And if you read the bottle, it's 0.4 milligrams per spray. This one container holds 75 potential doses. So we need to make sure it's indicated for a chest pain patient. Maybe you've done a 12 lead or 4 lead and they have ST elevation in V1, V2, septal MI. Definitely indicated to give nitro as long as it's not contraindicated. So we're going to talk about this medication. What are the benefits of giving sublingual medication? Ease of access, totally. This medication, 0.4 milligrams, is easily absorbed and fastly absorbed as a vascular smooth muscle relaxant. Works very fast, which decreases the cardiac workload, which increases oxygenation of the vessels that are potentially affected in an MI or a chest pain patient. How do we prepare this medication? Not too difficult. We spray it away from us, away from your patient, away from your partner, others, closely to the ground so it doesn't go wafting up into the air. So you want to be safe with this medication. It will cause you to have a headache or it could cause you to go unconscious. Let's see if we get a nice fine spray. This is how we prime it. Not bad. So we got our medication prepared now, and we want to make sure we prepare our patient next. We need to ensure that this drug is not contraindicated though. What are some of the contraindications of giving nitro? Well, they would have maybe an allergy. That's right. Let's go through our 7 R's of patient medication administration. So depending on where you work, the blood pressure could be a contraindication. In Nova Scotia, for example, if your blood pressure is less than 90 or your heart rate is less than 50 or greater than 150, it's contraindicated. Okay? If they're allergic to it, contraindicated. One person I met one time was allergic to nitro. What did it cause as a side effect? Cardiac arrest. Did not give it to that patient. Other things are like ED drugs, erectile dysfunction drugs such as Viagra. If they've taken that within the last 24 hours, don't give it. For the other ED drugs, it's within 36 hours. We can't give that drug. I have had the experience of asking a patient if they had these ED drugs. They denied it, the medication was given, and they went unconscious. When they're awake, asked the question again and said, this could kill you if you're allergic to it, or if you've taken the ED drugs. They admitted to it because they were a little embarrassed. So I like to tell them that this will have an undesired consequence if they deny taking the drug when in actuality they did. So confirm. Okay, our patient sits or they lie down. We make sure that their tongue is lifted up adequately so that when we point that nozzle towards those nice blue area under the tongue, we can adequately spray and wet that down essentially. We can give a spray every 3 to 5 minutes. Check local protocols. In PEI, it's every 5 minutes. In Nova Scotia, it's every 3 to 5 minutes, as long as they have pain. If they have 1 out of 10 pain, we can give a spray of nitro. The goal of chest pain is to have 0 out of 10 pain. In PEI, you can give it every 5 minutes, up to a max of 3 for a PCP. More than that, if they still have chest pain, they want you to call medical online control. It would be very good to have an IV in place if possible, in case there's a big drop in blood pressure, which could happen with an inferior MI, so that there's a precaution in place for that. So you want to observe the desired effects for nitro spray, which would be lessening of chest pain, or the potential side effects, which mean they could be dizzy, they could have a headache, and we have to watch those drops in blood pressure as well. So that's sublingual administration of nitroglycerin. Do you want to go through the 7 rights again? Why not? The 7 rights, the right drug, nitroglycerin, sublingual administration for chest pain. That would be the right patient that has chest pain, that through a good history and assessment and a differential diagnosis, we ascertain to be of cardiac origin. The right dose, sublingual medication nitro, 0.4 milligrams per spray. The route, sublingual. Refusal, we ask the patient if we can administer this medication, so they have the right to refuse. The right time could be between 3 to 5 minutes, as indicated for chest pain. You need to document it, desired effects or the undesired effects of this medication. And I like to include 8th right, which is the right partner. Confirm with your partner that this drug is not expired and that we can use it right now. That's everything. That's sublingual medication administration of nitroglycerin. There's other medications you can do sublingual as well. What are they? Why not put them in the comment section below? I've said enough. Bye for now.